Hi, folks. My name is Greg Turner, the radiology coach. My job is to demystify the enigmatic world of X-rays. Obtaining radiographs can be a challenge for anyone who hasn't had extensive training in the field. In addition to trying to master techniques, positioning, machine operation, and patient care, imaging specialists must realize the expectations from their doctors and radiologists. Here are some special recommendations on how X-ray operators can manage their X-rays and garnish praises from the doctors. Step 1. Don't submit images that lack anatomy. Unfortunately, it isn't uncommon to take some X-rays and miss or omit a portion of the anatomy of a patient. In rare cases, this may be okay, but most of the time, physicians need to see all of the concerned anatomy. For example, if a foot X-ray is ordered, all of the foot must be included. In order to achieve this, the radiographer should include all of the foot in the image to extend above the ankle joint so that the adjoining bones and joints are included on the films. The rule of thumb is to include more, not less. If there's too much on the film, the physician will alert you of this. Fundamentally, the doctor or radiologist must comment or dictate on all of the body part that has been X-rayed. If a portion of that body part is missing, it subjects the doctor to unnecessary liability. The trick here is for the X-ray operator to be fearless when asking a patient for additional X-rays if a mistake has been made. The operator must also communicate effectively with the physician and continually get feedback, which leads us to the next step. Step 2. Speak with physicians regularly to get feedback on X-rays. This can be challenging to get a busy physician to engage with you, but when practitioners are upset with films, they will be more than willing to let you know. It is probably advisable not to ask the doctor about your specific work, but to pick his brain about the collective submissions of all the X-ray operators. This step alone can have a significant impact on the physician's perspectives on the radiology staff. Step 3. Modify the grayscale and brightness for best visibility. Many radiologists have been quoted as saying, "Don't modify the images when you obtain them. We'll adjust them here." Sometimes X-ray software doesn't send what is referred to as the raw image to the workstation of the doctors. If the raw image is not in the data, it limits the doctor's ability to manipulate the look of the film. Over time, however, the practice of withholding the raw image has diminished, so in most cases, it is safe for X-ray staff to adjust the grayscale and brightness to the liking of the physician. Step 4. Find a place on the digital platform to document the patient history. When physicians, particularly radiologists, are reviewing X-rays, they often have to cross-reference the X-ray with paperwork, creating a toggling workflow that can be a nuisance to work with. If the X-ray operator takes the extra time and effort to include a short, abbreviated patient history in the notes, the reading physician will appreciate the efforts of your clinic and will learn to rely on the notes as reference. Step 5. Triple check your markers. It may feel like overkill, but when administering X-rays, it is incumbent on the X-ray specialist to mark their film with a lead marker every time. If the films have not been marked with a permanent hard marker, then the user should mark the film with a digital marker. Now, this is not the DICOM marker where the user indicates which limb is being X-rayed when typing in the information into the X-ray software. This is a digital marker that can be dragged into the X-ray field. It is usually a red or white marker. Once the film has either a hard lead marker or a digital marker, then the user must check the DICOM labels on the periphery of the image to make sure that all of the demographics indicate the correct limb or patient side. When all information is consistent, then X-rays can be sent to the doctor for review. Step 6. Continually evaluate your technique factors. It is not uncommon that the settings on the X-ray console constitute over or under exposure. Even when digital X-ray systems can generate an X-ray, the quality of the image drops if the kVp or milliamps are off the mark. Ways to determine if your technique factors need adjusting would be to look for artifact on the X-ray. This might look like extreme black areas, extreme white areas, speckling on the film, or a haziness that resembles motion. These could all indicate whether or not your factors are appropriate. You can contact your X-ray dealer to find out if your system has what we refer to as the exposure index. This is a readout that most systems have that will indirectly let you know if the amount of X-rays you are using is anywhere close to what it needs to be. Over time, you can refine your techniques, create a technique chart for other specialists to refer to, and refine the quality of all X-rays that are submitted by your department. This concludes our segment on how to get docs to love your X-rays. If you like this presentation, please select the subscribe button below this video. You can also tap the bell next to it so that we'll notify you when other great videos have posted. My name is Greg Turner, and I'm the Radiology Coach. And remember, mark my word and mark your films.